Good morning, everyone. My name is Sam. I'm a GP. Welcome to my Common Sense Medicine class. Today's topic is about practical anatomy and physiology. And the specific topic that I want to cover today is cardiovascular system. Before I go on, as usual, I'd like to show my disclaimer. So let's take a look at the cardiovascular system. The cardiovascular system is made up of the heart, the artery, and the vein. So the heart is a muscular pump that pumps blood in a closed circuit or a closed system throughout the body. It delivers blood rich in oxygen to all parts of the body and receives blood low in oxygen back from all parts of the body. And here we got the artery here. The artery is a blood vessel highlighted in red here that carries blood rich in oxygen to the rest of the body. Whereas the vein is a blood vessel that carries blood low in oxygen from the rest of the body back to the heart. Now, let's take a look at the anatomy of the heart. In this view, we can see that on the left-hand side is a normal front view of the heart. And on the right-hand side, we have got the open front view of the heart. As can be seen here, there is the right atrium, referred to by the yellow arrows, which receive blood low in oxygen from the rest of the body and pumps it to the right ventricle, which is being identified here by the pink arrow. The right ventricle then pumps the blood again low in oxygen to the lung to be oxygenated. Next, we have got the normal back view of the heart. On the left-hand side is a closed view of the heart, and on the right-hand side is an open view of the heart. Here again, we see that the left atrium is being identified by the yellow-orange arrows. The left atrium receives blood rich in oxygen from the lung and pumps it to the left ventricle. The left ventricle then carries and pumps this blood rich in oxygen into the aorta, which then delivers it to the rest of the body. Next, let's take a look at the blood vessels. Here we have got both the front and the back view. First, we have got what we call the inferior vena cava. Inferior vena cava is a large vein that carries blood low in oxygen from the lower parts of the body back into the right atrium. And here we have got the superior vena cava. The superior vena cava carries blood low in oxygen from the upper parts of the body, including the head, the neck, and the upper limb, back into the right atrium. Next, we have got the pulmonary arteries. The pulmonary arteries carries blood low in oxygen from the right ventricles and deliver it to the lung to be oxygenated. And next, we have got the pulmonary vein. The pulmonary vein carries blood rich in oxygen from the lung back to the left atrium. The aorta is identified here by this curved large blood vessel here. It carries blood rich in oxygen from the left ventricles and deliver it to various parts of the body. In this view, we can see that this is an open view of the heart, demonstrating both the right side of the heart, which is the right ventricle, and the left side of the heart, which is the left ventricle. Behind each of them is this right atrium and left atrium respectively. In the right ventricle, we can see that there are two valves. Valves are essentially doors that separates the atrium from the ventricle. They also act as a one-way valve that prevent the backflow of blood. For instance, the tricuspid valve is a door between the right atrium and the right ventricle. It prevents the backflow of blood from the right ventricle back into the right atrium when the right ventricle contracts and the pressure increases. Next, we have got a pulmonary valve. The pulmonary valve is a one-way valve under normal circumstance, of course, that prevents the backflow of blood from the pulmonary arteries back into the right ventricle when the right ventricle relaxes and the pressure drops. In a similar way, on the left side of the heart here, we can see that there are two valves as well. There's a mitral valve. The mitral valve acts as a door, a one-way valve between the left atrium and the left ventricle. The left ventricle, when it contracts, as pressure in the left ventricle increases, the mitral valve prevents the backflow of blood into the left atrium. And the last valve we are talking about is aortic valve. The aortic valve is a one-way valve between the aorta and the left ventricle and acts as a one-way valve that prevents the backflow of blood from the aorta back into the left ventricle when the left ventricle relaxes and the pressure drops. So, in summary, this is the function of the heart. The right atrium receives the oxygenated blood returning from the rest of the body. It then pumps it into the right ventricle. The right ventricle then pumps this blood low in oxygen to the lung to be oxygenated. The oxygenated blood from the lung then returns back to the left atrium, which pumps it to the left ventricle. The left ventricle then pumps the oxygenated blood around the body. And here is the function of the artery. Artery carries blood rich in oxygen away from the heart to the rest of the body and supplies all the following system: the musculoskeletal system, the skin, the nervous system, the ear, the nose, the throat, the eye, the digestive system, the endocrine system, and the male and female reproductive organs. The only exception to this rule is the pulmonary arteries, which carries blood away from the right ventricle, but then it is very low in oxygen, not rich in oxygen. And here is the function of the vein. Vein carries blood low in oxygen from the rest of the body back to the heart. It receives blood from the following organ system: the musculoskeletal system, the skin, the nervous system, the ear, nose, throat, the eye, the digestive system, the endocrine system, and the male and female reproductive organs. And the blood is low in oxygen. The exception to this rule is the pulmonary veins, which returns the blood back to the left ventricle, to the left atrium, and is very rich in oxygen. In summary, the heart, the artery, and the vein work in a closed system. Blood is carried within the artery and the vein and is constantly pumped around the body 24 hours a day, 7 days a week, and 365 days a year within a closed system. Any process that disrupts this closed system and disrupt the flow of blood is going to cause problem. So, diseases can be classified as diseases of the heart, diseases of the artery, and diseases of the vein. All these will be discussed separately in part 2 of this series. Thank you very much for watching my YouTube video. If you like my presentation and my structure of presentation, please kindly subscribe and share. Stay alive, stay safe, and stay healthy. Many thanks. Have a nice day.